Mr. Saktiandi.
Mr. Speaker, all hospitals are required to financially counsel a patient receiving inpatient care or day surgery. For planned admissions and surgeries in public hospitals, financial counseling is done prior to admission or surgery. For emergency cases, however, the priority is on quick diagnosis and intervention. And so in those cases, patients are counseled as soon as possible after admission. If there is a significant increase in estimated bill size during the course of the inpatient stay, which could occur for reasons such as complications that were not anticipated prior, the patient will be provided with an estimated update as quickly as possible. Patients are counseled based on their financial status and the subsidies they are eligible for, as well as the expected MediShield Life payouts and also the available MediSave withdrawals for their specific treatment and their condition. Information is presented in an easy-to-understand way, such as in a graphical way, to explain the estimated bill size and also the out-of-pocket payments that they will be expected to incur. Patients are also advised to choose the appropriate ward type based on their own circumstances. For example, patients with concerns over the bill size would be advised to choose a ward type that would give them access to higher government subsidies. If they indicate a financial difficulty, they will then be asked whether they wish to be referred to a medical social worker to explore additional financial assistance. Finally, patients may also approach hospital staff to request for financial assistance at any point in their healthcare journey, at any stage, and they will be referred to a medical social worker for assistance. And the patient's medical needs will be prioritized, and no one will be denied appropriate care because of financial constraints. Thank you, sir.
Mr. Saktiandi.
Mr. Speaker, I'd like to thank SMS for the answers he gave. The reason I'm asking the question is two supplementary questions, or probably just one. Is probably I'm getting quite a number of my residents coming to my Meet the People sessions with regards to post-treatment out of hospital. My sense is, and the reasons why I'm asking this question, is whether there can be more further streamlined or maybe enhanced processes at the payments counters to assess them and refer them to the social service officers instead of actually waiting for them to actually request for referrals themselves. And I was wondering whether that can be enhanced even further, following up from the question that I've already asked on the PQ side. Second is in terms of referral to the social service officers at the hospitals, how is the process, maybe SMS can share, how is the process can be refined even further, enhanced even further for elderly patients or patients who are there alone and may not be able to converse or understand properly what the bill means and entails in their financial, in terms of the financial circumstances, and whether there can be any help from the counter staff themselves and also nurses. Thanks.
So there's a framework for trying to estimate as closely as possible upfront prior to the admission and prior to the procedure itself, as far as possible to estimate what it will cost, likely out-of-pocket expenses, and then to right-size the kind of stay, the ward choice, and so on, appropriate to the particular patient's own financial means and circumstances. Obviously, the way in which this is conveyed would also depend to a large extent on the patient himself or herself, and whether this person is conversant in one language or another. As I mentioned earlier, steps are also taken beyond just counseling, verbal counseling, to also present information in easy-to-understand ways, in graphics, in charts, to explain those as using those as aids as well to the patient. So I understand the patient's point that ultimately what we want to achieve is a greater understanding upfront of the likely expenses and so on as far as possible, so that there is no big surprise at the end. On the member's first point, we do have a process where there is a proactive intervention in terms of trying to give information proactively, especially for patients who might be identified as someone who is not able to understand the treatment processes and also may not even know what questions to ask. And would like to let the member know that in 2014, MOH has introduced the Proactive Financial Assistance, PFA, to alert patient service associates who deal with the patients about patients who might require financial assistance. This is drawn proactively from information stored in the National Electronic Financial Records, and is obviously available to help patients who have prior to that given consent for their information to be accessed. So looking at the nature of the procedure, the likely costs of the expenses that will be incurred, matched up with what we know from the NEFR, the counsellors would be able to more proactively manage the cost upfront for the patient and provide the advice upfront, even if it's not asked for. So this, plus a series of other measures on the ground, will be taken. But I understand the member's point that ultimately it is about awareness upfront and to try to anticipate as far as possible and as accurately as possible the likely expenses that will be incurred, and we will endeavour to do so.